We have a lot of text messages here, WhatsApp messages, which people send from different all over the world. And today we're going to look at some of them once again. Let's look at this one. Dr. Save a Life, I know God has blessed you, but may He give you long life for this wonderful work you are doing. God bless you. Just a quick one. One of our colleagues just died. Some say it is heart attack. Others say MI. What is the difference, and how can one know chest pain from the heart? God bless you more. Thank you very much. Okay, this is why we're here. This is what we're talking about. The colleague just died, and they say he had heart attack. Is heart attack preventable? Yes. When it has to do with heart attack, all right? In heart attack, when there is a sudden narrowing of the blood vessels of the heart, that coronary artery, if it gets narrowed, all right? And when it gets narrowed, blood will not be able to reach, meaning that oxygen will not reach to certain muscles of the heart, and that muscles of the heart will start dying. And before you know it, that thing you normally see like this going up and down, will now start doing everything, jaga, 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 phew, that very person will now die. Otherwise, when that initial blockage is done and it is identified, what is called angiogram is done to show that there is a block. You can do angioplasty. That very person is supposed to be alive. That's why I said, majority of the people that were buried in this side of the world, if what is professionally and technologically available in our time today is applied to them, they will be alive. I can tell you that. When such happen, he said this person is having heart attack. Be that as it may, the classical presentation of that particular heart attack is professionally called myocardial infarction. When there is blood loss, infarct means that there's no oxygen, there is no blood reaching to that particular place. We now look, start dying, as you can see here. Also, if there is no oxygen reaching to that particular, if there's no blood reaching to that place, it's an ischemic. That's why you can have ischemic stroke and all that. All right. So, but that myocardial infarction, otherwise abbreviated as MI, meaning that it is sum total that this very person had heart attack. So invariably that's same. It's not that this one is more professionally used. This one is a word that is conventionally, being mentioned in the public. But it's also important for us to be at this juncture to mention that this particular issue of heart attack, even though it happens sometimes, but if you have been doing routine health check, most of those things can be identified even before the worst happen. He asked a question: how will I be in position to know that this very chest pain I'm having, perhaps the man also complained of this chest pain before he passed, this chest pain I'm having, is it of which origin? And when will I know if the origin is coming from the heart? Now, if you look at the issue of heart, where is the heart actually located? Initially, we were told that the heart is actually sitting at the left side of your chest, but ideally and anatomically, your heart is sitting at the center. It's just the apex beat that is actually tilting towards that very side. So, on that particular accord, your heart is only part of the numerous organs that you can have in the chest region. And one thing about it is that part of the things it can show you is that it may show you some sense of pain, it can show you palpitation, it can show you some other things. But it's not the only contributor to that. Now, look at it here. If you check out from the head, all right, there's this thing we call the spinal cord, all right, there's a bone, about 83 pieces of them that run down, and the extension of the brain, as it were, goes right in there through that you call it the spinal cord. But something unique happens there is that it throws out what they call nerves. It is this very nerves that is throwing out this way, but if you look at it graphically, you can discover that there are so many of such nerves thrown from the back and coming upwards here. Interesting, isn't it? So if you see that kind of all coming in here, so when they come so much from the back and converge in front of the body, it means that there is a problem. The problem is that because they are interconnected, so many organs around this region can mimic each other in terms of presentation of a concern. If it is something of pain, you look at, okay, right, how many organs, look at this anatomical structure, how many organs are within this particular chest region? Of course, you can see that the lungs is there. You can see also the stomach just a little bit beneath that particular chest. You could also see, then also prominent here, behind the stomach you have the head of the pancreas, all right? You also have the liver by the right side, you have the gallbladder underneath, you also have the heart as established, you see the esophagus and a number of other things, a lot of them there. The implication of this networking is that a pain that is coming from here can come to the chest and can go to the back. And that's why a person that has a problem of peptic ulcer, for instance, could have a chest pain here or this person that can still transmit to the back. A person that has a problem of hiatus hernia or the issue of gastroesophageal reflux disease or gastritis or even a stomach cancer or something of the head of the pancreas having a kind of inflammation that is a tumor or whatever, can transmit the pain to the chest. The pain can also go to the back. If it is somebody that has a problem that has to do with the liver, the case of issue of liver cirrhosis, the issue of liver cirrhosis, the issue that has to do with liver abscess and the rest, the pain will come here. Under that liver, as you can see the gallbladder right there, you can also have a pain coming also here. So, pain that could be described as chest pain is a non-specific symptom. The word is a non-specific. It is not so clear where it's coming from, for which you will not say, no, I used to have ulcer. That's what kills most of our people. You know, I used to have ulcer. Come on, you could be having ulcer, something else could be also happening at the same time. So it is not a function of which one exactly is coming from the heart. I can tell you the same way it could come from other things, it also come from the heart. And the reason why you should give a priority to your health evaluation, considering the fact that of all those different diseases I've mentioned now, the one that kill without much notification has to do with the heart. So don't wait for the one to know the one that is coming from the heart. Comprehensive evaluation from time to time. And if you have something of your body that is not this, not your pattern, friend, go to hospital. It is cheaper to spend money, be healthy, be there for the destiny of your children. I can tell you, if you go out of that room, no matter any reason, you can corrupt the destiny of someone, indirectly or directly.
My name is Dr. Damian Chiagromo Parocha. I am a surgeon, a consultant surgeon that works in Federal Medical Center over Imo State. I want to thank God especially because I had a heart attack, and this happened in my house around 5 a.m. I actually had sudden heaviness of the heart, chest pain, and began to lose breath. I couldn't breathe again, and suddenly I collapsed. I want to especially use this opportunity to thank my wife for acting promptly to save my life. Again, I want to thank the medical director of Federal Medical Center, where Dr. Kingsley Achibu. He actually arranged for my being taken to Port Harcourt. The major treatment happened in Port Harcourt in Save a Life Mission Hospital. Before I reached there, Dr. Richard Okoye got to know about it, connected the interventional cardiologist, and everything was waiting before my arrival. So as we arrived there, I was taken straight to the cath lab. The cath lab is where the cardiac angiography was done, And from there, they also did a cardiac intervention bypassing a stent, and that's why I'm alive today. Myself that is talking today, if God had not saved me, maybe the whole family would have been in shambles. For I have 5 children and a wife I would have left behind. My wife is a civil servant, and I have 5 children. 2 of them are graduates, and 3 of them are still in the university. In fact, 2 are studying abroad. If I had left them behind, it would have been a disaster. So God has a reason for keeping me, so that people can live to be able to fulfill their destinies.